Today, we are going to discuss the nursing management of the newborn with both acquired and/or congenital conditions, the difference in each condition, and the specific syndromes and anomalies in each category. The advancement in prenatal and neonatal medical and nursing care has led to a marked increase in the number of newborns that have survived a high-risk pregnancy but experienced acquired or congenital conditions. These newborns are considered one of the most vulnerable at-risk populations. We will discuss each of these listed acquired conditions. All of the above acquired conditions are obtained after birth by a reaction to environmental influences outside the body of the newborn. They are not passed genetically or caused by hereditary or developmental factors. Perinatal asphyxia is characterized by clinical and laboratory evidence of acute or subacute brain injury due to systemic hypoxemia or reduced cerebral blood flow. Asphyxia is the most common insult in the perinatal period. Despite improved survival rates and advances in perinatal care, many high-risk newborns are at risk for respiratory problems, particularly respiratory distress syndrome. The most common risk factor is premature birth. Other risk factors include cesarean birth, male gender, previous infant with RDS, perinatal asphyxia, cold stress, and maternal diabetes. The Silverman-Anderson Index is an assessment scoring tool that can be used to evaluate 5 parameters of work of breathing and assigns a numerical score for each of the parameter. The diagnosis is based on the clinical picture, X-ray findings, and arterial blood gases that show hypoxemia and acidosis. RDS affects approximately 20,000 to 30,000 infants born alive each year in the United States. The incidence declines with the degree of maturity at birth. If left untreated, RDS will worsen. Often the infant's respiratory symptoms decline after 72 hours of birth, which parallels the production of surfactant in the alveoli. Care of the newborn with RDS is geared towards supportive and requires a multidisciplinary approach to obtain the best outcomes. Therapy normally is focused on improving oxygenation and maintaining optimal lung volumes. The fact that meconium is rarely found in the amniotic fluid prior to 34 weeks, it mainly impacts term and post-term infants. Risk factors are listed on page 914 in your text. When aspirated into the lungs, meconium blocks the bronchioles, causing an inflammatory reaction as well as a decrease in surfactant production. This process causes impairment of gas exchange and atelectasis occurs. ABGs will indicate metabolic acidosis with a low blood pH, decreased PaO2, and increased PaCO2. Nursing management focuses on ensuring adequate tissue perfusion and minimizing oxygen demand and energy expenditure. Vigorous suctioning was used in the past on infants in an effort to clear the airway and reduce the incidence and severity of MAS. However, there have been 2 large studies that have proven close monitoring in the NICU has better outcomes for the infant. Persistent pulmonary hypertension risk factors include maternal smoking, maternal obesity, maternal asthma, congenital heart defects, among others listed on page 916. Current research found that the risk of developing persistent pulmonary hypertension has been linked to the infant's exposure to selective serotonin reuptake inhibitors in utero. PVH, IFH, is defined as bleeding that usually originates in the subependymal Germanix matrix region of the brain, often extending to the ventricular system. Complications include hydrocephalus, seizure disorder, cerebral palsy, cognitive impairment, among a few others in your text. Approximately 50% occurs by 24 hours of age and 90% by 72 hours of age. The nurse would need to assess for the risk factors listed on page 917, nurse management, mainly encompasses supportive care, minimizing handling, and supporting the parents for the diagnosis and possible long-term effects. Necrotizing enterocolitis, or NEC, is an inflammatory disease of the bowel which can cause ischemic and necrotic injury in the GI tract. It is the most common and most serious acquired GI disorder among preterm infants, and it's linked to the significant acute and chronic morbidity. This disorder occurs in about 10% of infants who weigh less than 1,500 grams, with mortality rates up to 50% mortality. The most common types of malformation in infants with diabetic mothers involve the cardiovascular system. Nursing management would include preventing hypoglycemia, maintaining fluid and electrolyte balance, and providing parental support. The most frequent and significant birth injuries are to the skull, brain, and spinal cord. It is estimated that birth trauma in the U.S. occurs in about 29 out of 1,000 births. Risk factors can be found in the labor and birth history, such as prolonged labor, abnormal or difficult presentation, or forceps or vacuum use during delivery. Perinatal substance abuse is a persistent and significant public health issue, particularly affecting children, with high rates of reported abuse, neglect, and foster care placement. The National Institute on Drug Abuse suggests that over 15% of women use alcohol or illicit drugs while pregnant. The type of substance and the timing of use during the pregnancy gauge the effects of the substance on the unborn fetus. Children with neurologic defects related to alcohol primarily display intellectual disabilities related to behavior and learning, while birth defects caused by alcohol include defects of the heart, kidneys, and/or bones. The clinical picture of fetal alcohol syndrome is in box 24.2 in your text. Neonatal abstinence will be discussed on the next slide. Neonatal abstinence syndrome, or NAS, is when the fetus suffers withdrawal symptoms resulting from chronic intrauterine exposure to a variety of substances. Maternal history to identify risk behaviors are listed on pages 931 through 932. The nurse can play a pivotal role in assisting the mother to abstain from further drug use and promoting effective parenting skills. Hyperbilirubinemia results from unconjugated bilirubin being deposited in the skin and mucous membranes and is exhibited as jaundice. Bilirubin production increases after birth, mainly because of the shortened red blood cell lifespan, 70 days in the infant versus 90 days in the adult. Risk factors are listed on page 937 in your text. Neonatal sepsis is an infection that occurs within the first month of life. Bacterial infections remain a major cause of illness and death in the neonatal period. The rate of mortality may be as high as 50% if untreated. Common nonspecific signs are listed on page 941 and 942 in your text. Antibiotics are continued for 7 to 21 days if cultures are positive, or they are discontinued within 72 hours if cultures come back negative. Therapy is generally started before lab results come back. Each year, an estimated 8 million children are born with a serious birth defect. Congenital conditions may be inherited or sporadic, isolated or multiple, apparent or hidden, gross or microscopic. Congenital conditions can affect just about every body system. The incidence of esophageal atresia is 1 per 3,000 to 4,500 live births. The etiology has been linked to genetic factors, infections, and teratogens, but unfortunately in most cases there is no identifiable cause. Esophageal atresia and tracheoesophageal fistula are thought to be the result of incomplete separation of the lung bed from the foregut during the early development of the fetus. These newborns also show a large percentage of having several congenital anomalies involving the vertebrae, kidneys, heart, and musculoskeletal and GI systems. Omphalocele are associated with other anomalies in more than 70% of the cases. The abdominal contents with gastroschisis have no protective sac in utero and are exposed to amniotic fluid, which makes them thickened, edematous, and inflamed. A pediatric surgeon is required to be at the delivery to assess the extent of the damage. With an omphalocele, fetal abdominal wall defects result from disturbances in organogenesis during the early embryonic period. Gastroschisis occurs in 1 in 2,000 live births, and omphalocele occurs in 1 in 4,000 live births. This malformation occurs during early fetal development and may be associated with numerous other congenital anomalies in other body systems. The major nursing assessment for this anomaly is no meconium passed within the first 24 hours of life. Nursing management focuses on preparing for surgery and providing post-operative care, along with education and support to the parents. Classic bladder exstrophy occurs when there is a midline closure defect during the embryonic period that leaves the bladder open and exposed outside the abdomen. Complications include UTI from ascending organisms. All material is referenced from Chapter 24 in your Ricci book.